Welcome, everyone, to the 2022 IAS-USA Guidelines Virtual Update. We're going to be talking over the next few hours on antiretroviral drugs for treatment and prevention of HIV in adults. Next slide. Before getting started, I just do want to commemorate the fact that there's been 30 years now of IAS-USA really focusing on bridging the gap between research and patient care, and really a special year as we think ahead. My name is Raj Gandhi. I'm at Massachusetts General Hospital and Harvard Medical School, and I'm joined by my co-chair, Dr. Mike Saag. Dr. Saag?
Yeah, hi, everybody. I'm Mike Saag from UAB in Birmingham. Real excited to have a part in today's symposium.
Wonderful. So what we're going to be doing in the next little bit is talking through a number of our recent guidelines from IAS-USA. And before we get into that, though, I'd like to introduce our faculty. These are all members of the IAS-USA Guidelines panel, starting with Dr. Roger Badimo at UT Southwestern, Dr. Susan Bookbinder at UCSF, Dr. Ellen Eaton at University of Alabama, Birmingham, Dr. Huldrych Gunthardt from University Hospital Zurich, Dr. Rafi Landowitz at UCLA, Dr. Connie Benson at UCSD, Dr. Carlos Del Rio at Emory, Dr. Joe Aron at University of North Carolina, Dr. Jenny Hoy, joining us all the way from Monash University in Australia, Dr. Clara Lehmann from German Center for Infectious Research, and Dr. Jean-Michel Molina from Paris, Dr. Davy Smith from UCSD, Dr. Melanie Thompson from Atlanta, Thacker and Thompson, and Dr. Paul Sachs from Harvard, and Dr. Sandy Springer from Yale. So really an all-star cast here today. Let's go ahead and see the next slide. So I mentioned already that IAS-USA dates back 30 years, but really since near the beginning, since 1996, the organization has published ARV guidelines back starting in 1996. The latest iteration was just published on World AIDS Day and is shown there on the right. And let's go to the next slide. We were fortunate to publish these guidelines in JAMA, and for all of you who are interested, please do take a look at the detailed guidelines hot off the press from just a few weeks ago. The link is there, and you can log into JAMA to download a PDF. So the most recent iteration of the guidelines with what's new, and we'll be talking about much of those guidelines, many of those guidelines over the course of the afternoon. Next slide. So a couple of key updates. I want to draw your special attention to a few parts of the guidelines. We, of course, have updated recommendations on initiating and changing antiretroviral therapy. We've also updated recommendations on prevention of HIV infection, and you're going to hear some exciting new options there, and updated the sections on comorbidities, a really important part of the care of our patients with HIV. There are some new sections, and I'm going to call them out here. Given the need for integrated care of substance use disorder and HIV, we have a new section on that topic, and you're going to hear some practical tips over the course of the afternoon. And we have highlighted some new and emerging co-infections such as monkeypox. When you read the guidelines, what you'll know is that we rate our, what you'll notice is that we rate our recommendations, and it's based on the strength of the recommendation, strong support being an A recommendation, and then we also give the readers a sense of the quality of the evidence, and you see that in this slide. This is all presented in a way so that you see the process by which we came to our guidelines recommendation. And speaking of process, next slide, please. Actually, before getting the process, I'll get back to that. I do want to highlight that this program that we're in now is eligible for CME, and here's the CME information for your information. It is this live activity does count for up to 3.75 Category 1 credits. So do know that this is available for CME, and I think the next slide may come back to that. And here we have the CME credits, but also some of the other accreditations listed out clearly here. Now, we do want to acknowledge that earlier this week, there were some technical issues with the registrations system, and that might have prevented you from completing your registration. We will be following up if you did email for access. And there'll be instructions that will be emailed to you all the way through until tomorrow. But we do want to also share with you this email site, which is available for any questions at all. And then because of the technical difficulties with the registration system, we are providing the link to the course on the IAS-USA homepage. And if you did not register and would like to claim credit, please contact the link below. So essentially, you're able to join the course free of charge right now. And if you want CME credit, this is the way to get it. We are in the holiday season, so we do want to acknowledge that and provide this link to you. So let's go ahead and see the next slide. So now we get a little bit more into the process that I mentioned. So the IAS-USA panel is a volunteer group of experts who've really come together to develop recommendations and guidelines in areas that can be either confusing or controversial. You see our funding there. It's provided by the IAS-USA, and commercial support is not accepted. And the panel members that you're going to meet today are participating on a volunteer basis. And then funding for this course is provided by a collection of commercial entities. Next slide. Here are the grant support from those entities and from those supporters, and we do want to acknowledge and gratefully acknowledge their support. And also I'll point out for our financial relationships with ineligible companies. This was sometimes in the past called commercial interest by ACCME. Information about that is available online in the e-syllabus, and all of that information is available. IAS-USA has reviewed and resolved those conflicts. So without further ado, let's launch into today's agenda. We're coming to the end of the welcome and introductions, and I'm really thrilled to, in a moment, introduce the first lead. But what we'll do over the course of the program is cover when and what to start. We'll then highlight comorbidities in the setting of ART. We're going to get into monkeypox and COVID-19. And then in the second half, then we'll take a break. And then in the second half, we're going to talk about when and how to switch. I promised that we would be focusing on substance use disorder, and Drs. Ellen Eaton and Sandy Springer will really provide some practical tips. This will, the other sessions are interactive and case-based. This one will be practical tips. And then we're going to wrap things up with a review of HIV prevention and STI screening and prevention.